Imagine waking up tomorrow with stronger morning firmness and feeling more confident in your body again. Not because you took a pill, not because you ordered an expensive supplement, and not because you went through an awkward clinic visit, just because you learned one simple technique that supports healthy circulation and pelvic function in a way most men never hear about. In this video, I am going to show you a safe, beginner-friendly massage method you can do in about 1 minute. It is simple, private, and requires nothing but your own hands. And while it is not a miracle cure, many men find that gentle pelvic massage and better awareness of this area can support relaxation, comfort, and healthier blood flow over time. Here is the truth. As men get older, it is common for the body to respond differently. Morning erections may become less frequent. Sensitivity may change. Confidence may drop. And for many men, the hardest part is not the physical change. It is the silence. Most people do not talk about it. Many men feel embarrassed. Some feel like they have to accept it as normal and never ask questions. But you do not have to stay stuck. Over the next few minutes, I will walk you through where this spot is located, why it is connected to important nerves and muscles in the pelvic region, and how to massage it gently without pain or discomfort. I will also explain who should not try this technique and when it is important to talk to a qualified doctor, especially if you have prostate symptoms, diabetes, heart conditions, or ongoing pain. So if you want a simple, practical routine that takes 1 minute and supports your overall pelvic health, stay with me. Because once you understand the anatomy and the correct method, you will see why this is not about tricks. It is about working with your body in a smarter, calmer way. Now, before we go any further, let me quickly introduce who this video is for and why you can trust the information you are about to hear. My name is Dr. Grace Miller. I am a urology-focused physician, and for more than 20 years I have worked with men who want to understand what is happening to their body as they age, not just in terms of performance but in terms of confidence, comfort, and quality of life. And if you are watching this right now, there is a good chance you have been dealing with one of these frustrating situations. Maybe you wake up and the morning response you used to take for granted is not there anymore. Maybe you notice that firmness is weaker than it used to be. Or maybe everything still works sometimes, but it feels less reliable, and that uncertainty is starting to affect your mindset. If that sounds familiar, I want you to hear this clearly. You are not broken. You are not alone, and you are not the only man who feels embarrassed to talk about it. In fact, one of the biggest reasons men struggle for years is not because there is no solution. It is because they never get a clear explanation. Many men are given quick answers, rushed appointments, or generic advice with no real guidance. They are told it is just aging, or they are handed a prescription, and the deeper conversation ends right there. But here is what I have learned from years in clinical practice. When you understand the real reasons why function changes, you stop blaming yourself, you stop guessing, and you can start supporting your body with safe, realistic habits that make sense. That is exactly what this video is designed to do. I am going to keep this practical. I will not overwhelm you with medical jargon. I will explain the anatomy in simple language, and I will show you the exact technique step by step, including how much pressure to use, how long to do it, and what sensations are normal. Just as important, I will also tell you when not to do it and when you should speak to a licensed healthcare professional. This video is educational, and it is not a substitute for medical care. So if you are ready, let us get into the real science behind why this 1-minute method can support healthy pelvic function and why the spot you are about to learn is far more important than most men realize. And now that you know who I am and what this video is meant to do, let us talk about the part that most men never get explained in a clear way. Because once you understand the basics, everything else in this video will make much more sense. Think of your body like a well-designed system. When things are working smoothly, male function is not just about desire or willpower. It is about communication between 3 key systems that must work together at the right time. The first system is your brain and nervous system. This is where arousal signals begin. The brain sends messages down through the spinal cord and into the pelvic region, telling the body to prepare for a response. The second system is blood flow. For firmness to happen, blood vessels need to open and allow strong circulation into the tissues. If circulation is reduced, firmness can feel weaker, slower, or less reliable. The third system is your pelvic floor muscles. These muscles support the pelvic organs and play an important role in maintaining firmness once blood flow increases. If these muscles are weak, tense, or not responding well, it can affect both strength and control. Now here is the important part. As men age, it is normal for each of these systems to change. Nerve signals may become less sharp, blood vessels may become less flexible, pelvic muscles may lose strength or coordination, and when all three are slightly weaker at the same time, the overall result can feel like your body is not responding the way it used to, but that does not automatically mean something is permanently damaged. In many cases, it means the body needs support. It needs better circulation. It needs better muscle awareness. It needs calmer nervous system signaling. And it needs the pelvic region to stop being ignored. This is why a simple external massage technique can be helpful for some men. Not because it creates instant miracles, but because it supports the exact systems that tend to weaken over time. And if you are finding this explanation helpful so far, do me a quick favor right now. Hit the like button and comment the number 1 below. That tells me you want more practical men health content explained in a clear way, without shame, without hype, and without confusing medical language. Now in the next part, I am going to show you why pressure point stimulation can affect circulation and nerve response, and why one small area of the body plays a bigger role than most men realize. Now let us take that 3-system model and go one step deeper, because this is where the idea of pressure point stimulation comes in. When people hear the words pressure points, they often think of something mysterious or unscientific. But the truth is much simpler. Your skin is not just a covering. Under the skin you have nerves. Those nerves connect into larger pathways, and those pathways communicate directly with the spinal cord and the pelvic region. That means certain areas of the body can be more sensitive and more connected than others. So when you apply gentle, steady pressure to the right area, you are not doing magic. You are creating a signal. And your nervous system responds to signals. This is one reason pressure-based techniques have been used for a very long time in different traditional health systems. Today we can explain it in modern terms. You are stimulating sensory nerves. You are increasing local circulation. You are encouraging the muscles in that area to relax and respond. A good way to understand this is to think about jump-starting a weak battery. If the signal is slow or weak, the system responds slowly. But when you apply a direct and consistent stimulus, you can help wake up that pathway. Not instantly, not like a switch, but in a way that supports healthier communication over time. Now I want to be very clear here, because this matters for YouTube health content. This is not a medical treatment for erectile dysfunction. It is not a replacement for diagnosis. And it is not a guaranteed cure. Anyone who promises that is not being honest. What I am sharing is a safe educational technique that may support pelvic awareness, relaxation, and circulation for some men, especially when combined with good lifestyle habits. And here is what makes this specific point so interesting. The pressure point I will show you in the next section is located in an area where nerves, blood vessels, and pelvic floor muscles are all very close together. That means a small amount of external stimulation can influence comfort, muscle tone, and blood flow in the surrounding region. In other words, you are not just touching skin. You are interacting with one of the most important communication hubs in the male pelvic area. And that is why this technique can feel like it does 2 things at once. It helps wake up circulation and nerve response, and it supports the deeper muscles that help maintain firmness once blood flow increases. In the next part, I am going to reveal the exact location in simple language and show you how to find it safely in less than 10 seconds. Alright, now let us talk about the exact spot. This is the part of the video most men are surprised by, because it is an area that almost nobody thinks about, and almost nobody is ever taught about. The technique focuses on a small region called the perineum. That is the correct anatomical term. It is the soft area of tissue located between the scrotum and the anus. And before you click away, let me reassure you. This is not invasive. There is no insertion. There is nothing extreme or uncomfortable. This is simply an external massage on the outside of the body, done with 2 fingers, over clothing if you want, and in complete privacy. Now here is why this specific spot matters. Directly beneath this surface area is a dense network of nerves and blood vessels that communicate with the pelvic region. This includes pathways connected to the pelvic floor muscles and structures that play a role in male sexual response. It is also close to the prostate area, which is why some people describe this as an external prostate support technique. Again, I want to be responsible with the language here. This is not a medical prostate massage. It does not treat prostate disease. And it is not a substitute for a medical exam. But anatomically, this area sits near important structures, and stimulating it gently can increase awareness, relaxation, and circulation in the pelvic region. That is why I call it a hidden control hub. It is a place where circulation and nerve signaling come together. When those signals are weak, the body can feel slower to respond. When the area is supported, many men report feeling more warmth, more sensitivity, and a stronger connection to the pelvic muscles. Now let me show you how to find it. Sit in a comfortable chair or lie on your back with your knees bent. Take your index finger and middle finger together and place them in the soft area between the scrotum and the anus. Press gently. You may feel a slight firmness under the surface, almost like a cushion of tissue. That is the right spot. And yes, for some men it may feel slightly tender at first. That does not mean something is wrong. Tenderness can simply mean the area is tense, tight, or understimulated, especially if you have never paid attention to this region before. The key is to keep the pressure steady and never painful. In the next part, I will show you the exact 1-minute method step by step, including the safest pressure level, the correct motion, and the timing that makes it simple to follow every. Now that you have found the spot, let me show you the exact 1-minute method. And I want you to pay attention here because the difference between a helpful technique and an uncomfortable experience usually comes down to one thing: doing it gently and correctly. This is not about forcing anything. It is not about aggressive pressure. It is about consistent stimulation that supports relaxation and circulation in the pelvic region. So here is the full step-by-step routine. Step 1. Get comfortable. Sit in a chair where you can relax your legs or lie on your back with your knees bent. Make sure you are in a private space where you will not be interrupted. The pelvic area responds best when the body is calm, not rushed, not tense, and not distracted. Step 2. Locate the perineum. Use your index finger and middle finger together. Place them in the soft area between the scrotum and the anus. You already know what you are looking for, a small zone that feels slightly firm under the surface. Step 3. Apply steady pressure. This is the most important part. The pressure should be firm enough to feel the tissue under your fingers, but it should never be sharp or painful. If you feel pain, you are pressing too hard. Think of it like pressing a doorbell that is slightly stuck. You want enough pressure to activate it, but you are not trying to break it. Start light, then gradually increase until you feel a solid, steady contact. Step 4. Slow circular motion. Once the pressure is steady, begin moving your fingers in small circles. Keep the circles slow and controlled. Do this for 30 seconds in a clockwise direction. Then switch directions and do 30 seconds counterclockwise. Keep the pressure consistent the entire time. Do not speed up. This is not a workout. It is a stimulation technique. Step 5. Deep breathing. While you massage, breathe slowly. Inhale through your nose for 4 seconds. Hold for 2 seconds. Exhale through your mouth for 6 seconds. This breathing pattern helps the pelvic floor relax and can support better circulation in the region. And that is it. 1 minute total. No devices, no supplements, no complicated routines. Just 2 fingers, gentle pressure, slow circles, and calm breathing. Now here is what I want you to remember. If you want to try this safely, do not chase intensity. More pressure does not mean better results. Consistency is what matters. In the next part, I will show you the ideal schedule, how often to do it, and what realistic changes you may notice over time if you make this a daily habit. Now that you know the 1-minute technique, the next question is obvious. How often should you do it to get the best results? This is where most men make a mistake. They try it once, they expect an instant transformation, and when nothing dramatic happens overnight, they stop. But the body does not work that way. If you want to support circulation, nerve signaling, and pelvic muscle response, you need consistency. Not intensity. Consistency. Here is the schedule I recommend for most healthy men who want to try this as a simple wellness routine. Do it twice per day. 1 session in the morning, ideally soon after waking up when your body is naturally relaxed. This is a great time because it helps you reconnect with the pelvic region, improve awareness, and encourage healthy blood flow for the day. The second session should be done at night before bed. The evening routine is helpful because the body is slowing down, the nervous system is calming, and the massage can support relaxation in the pelvic floor and comfort in the surrounding tissues. Each session is only 1 minute. That means you are investing 2 minutes per day. That is less time than brushing your teeth. And that is exactly how you should think about it. A simple daily habit, not a dramatic event. Now there is one optional timing that some men find useful. If you are planning intimate activity, you can do this technique about 15 to 20 minutes beforehand. Some men report feeling increased warmth and circulation after the massage, which may help the body respond more naturally. But remember, this is not a guaranteed result. It is simply a way to support the body. Now let us talk about what you might realistically notice over time. In the first few days, many men report a warmer sensation in the pelvic region or a mild tingling feeling. That can be a sign of increased awareness and circulation. Within the first week, some men notice stronger morning firmness or a more noticeable response. By weeks 2 to 3, men often report clearer improvements in comfort, sensitivity, and reliability. And by week 4, some men feel like their pelvic function is more consistent and more natural than it has been in years. However, I want to be honest, results vary. If you have diabetes, cardiovascular disease, severe stress, or long-term circulation issues, progress may be slower. If your changes are more recent, you may notice improvement faster. The key is simple. Give it time, stay consistent, and listen to your body. In the next part, I will share advanced tips that can make the routine even more comfortable and effective without adding complexity. Now, if you have been following along and the routine already feels simple and doable, I want to share a few advanced tips. These are not required. You can get started with the basic 1-minute method exactly as I showed you, but if you want to make the experience more comfortable and support better long-term results, these small upgrades can help. Tip number 1. Reduce friction. Some men find that dry skin or sensitive tissue can make the massage feel slightly uncomfortable, especially in the beginning. A small amount of natural oil or an unscented lotion can help. You do not need anything expensive. The goal is simply to make the movement smoother so you can keep steady pressure without irritation. Tip number 2. Combine the massage with pelvic floor training. Right after your 1-minute session, try doing 10 to 15 gentle pelvic floor squeezes, also known as Kegels. Here is how. Contract the same muscles you would use to stop urination midstream. Hold for 3 seconds, then release fully. Do not rush, do not strain. The goal is control, not force. This is important because pelvic floor muscles play a real role in support and stability in the pelvic region. Strengthening them can help with comfort, control, and overall function. Again, this is not a cure for medical conditions, but it is a healthy habit many men benefit from. Tip number 3. Hydration matters more than you think. Good circulation depends on the health of your blood vessels and the quality of your hydration. If you are dehydrated, the body does not circulate as efficiently. So aim for a steady intake of water throughout the day. You do not need to obsess over numbers, but a simple goal like several glasses daily can make a difference for overall health. Tip number 4. Use warmth. Warmth relaxes muscles and encourages circulation. That is why many men find the massage easier after a warm shower or while taking a bath. The pelvic floor tends to soften, the body feels calmer, and the technique becomes more comfortable. Now let me say this clearly. These tips are not magic. They are not shortcuts. They are small lifestyle supports that make the routine more effective and more pleasant. And if this video is already giving you ideas that could support better health and better confidence, I want you to do something for me right now. Comment the number 2 below. It helps the channel, and it tells me you want more simple, safe, and practical men's health routines explained in a clear way. In the next part, I will cover the safety rules you must follow, who should avoid this technique, and when it is important to speak with a doctor. Now, before we move into the final challenge and wrap up this video, we need to talk about something very important: safety. Because no matter how simple a technique looks, your health always comes first. And I want this channel to be a place where you get practical information without misinformation or unrealistic promises. So here are the safety rules you must follow. First, never do this massage if you have acute pain in the area. If the perineum feels sharply painful, if it burns, or if you notice swelling, stop. Do not push through it. Pain is not a sign of progress. Pain is a signal that something may be wrong and needs medical attention. Second, do not massage if you have an infection, inflammation, open wounds, sores, or skin irritation in that region. Even a small cut or irritation can become worse if you apply pressure repeatedly. In that situation, the correct choice is to let the area heal and speak with a licensed healthcare professional if symptoms persist. Third, if you have a diagnosed prostate condition, be careful. That includes an enlarged prostate, prostatitis, chronic pelvic pain, or any ongoing urinary symptoms. Some men may still be able to do gentle external techniques, but it should be discussed with a qualified urologist who understands your personal medical history. Remember, this video is educational. It is not personalized medical advice. Fourth, do not overdo the technique. More is not better. Twice per day for 60 seconds is enough. If you start doing it many times per day, or if you press aggressively, you can irritate the tissues. That can lead to inflammation, discomfort, and the opposite of what you want. The goal is gentle stimulation, not force. And now the most important point of all. This routine is not a replacement for proper medical treatment. If you are experiencing severe erectile dysfunction, persistent pain, numbness, major changes in urinary function, or symptoms that could be related to cardiovascular disease, diabetes, hormone issues, or nerve damage, you need to speak with a licensed healthcare provider. Because in many cases, sexual health is connected to overall health. And sometimes the body is giving you an early warning sign that should not be ignored. So think of this massage as a supportive habit, a way to improve awareness, comfort, relaxation, and circulation, not as a cure, not as a diagnosis, and not as a substitute for medical care. If you follow these guidelines, most healthy men can explore this technique safely as part of a broader wellness routine. Now, in the next part, I will give you the simple 30-day challenge that makes this easy to follow, and I will show you how to track your progress without stress or unrealistic expectations. Now, let us close this video with something simple, clear, and powerful. Because if you remember only one thing from today, it should be this: you are not broken, you are not alone, and you are not out of options. What we covered in this video is not a miracle cure, and it is not a replacement for medical care, but it is a safe, practical wellness routine that many men can use to support pelvic relaxation, circulation, and better body awareness. And the best part is that it does not require anything expensive. No pills, no equipment, No awkward conversations, just 1 minute, done correctly. So here is the plan I want you to follow. The 30-day challenge. For the next 30 days, do the massage twice per day. 1 minute in the morning, 1 minute before bed. Week 1 is about learning and comfort. You are simply building the habit and finding the right pressure. Week 2 is about noticing changes. Warmth, sensitivity, less tension, and stronger morning response can all be signs your body is waking up. Week 3 is where most men feel the routine becomes automatic. This is when confidence starts coming back, not because you forced anything, but because you supported the systems that matter. Week 4 is your progress check. Look at where you started and where you are now. Even small improvements are proof that your body can respond when you give it the right support. And here is my best advice. Do not chase intensity. Chase consistency. Your body does not need extreme methods. It needs calm signals, better circulation, and healthier pelvic muscle response over time. And if you have diabetes, heart disease, prostate conditions, or persistent pain, please speak with a licensed healthcare professional. Your sexual health is part of your overall health, and it deserves real attention. Now, if you stayed until the end, I want you to do 2 things. First, subscribe to the channel and turn on notifications, because I will be sharing more simple, science-based men's health routines that you can actually use. Second, leave a comment below and tell me you are starting the 30-day challenge, because your comment might be the reason another man finally stops suffering in silence and starts taking his health seriously. Thank you for watching, and I will see you in the next video.